My name is Ro Yoon. I use she and her pronouns, and I'm the community educator for the Seattle Vaccine Trials Unit with Fred Hutch. As a community educator for Seattle Vaccine Trials Unit, I am responsible in coordinating all our community engagement activities with our stakeholders and community partners so that they are fully aware of the research endeavors that we pursue, but also to get their support in this effort. I started HIV prevention work in 1988 when I was living in London, and I was introduced by ACT UP London to help in their efforts to share information on how to inject drugs without putting other people or putting oneself at risk. And that is an example of a population that is highly stigmatized in the beginning of the AIDS epidemic. Because as you recall, it was the four H's. It was the hemophiliacs, the Haitians, the heroin addicts, and the homosexuals. And those were the primary populations in the early onset of the AIDS epidemic that was truly stigmatized. And as a result, those communities got really fucked up information about HIV, depending on where they were getting that information from. And although I see many strides now in terms of how HIV looks like, and it's different, obviously, you could still see elements of that stigma that necessitate unique approaches to community engagement. When we're talking about the Asian Pacific Islander, for example, we could see that maybe medical institutions are not the right source of sharing information, and maybe looking at alternative like leaders, popular opinion leaders. So depending on the audience, depending on the community, there are different strategies to enhance that sharing of information. We always have to remind ourselves that HIV is one of many health disparities that these vulnerable populations are burdened with. And as a result, we need to connect the dots, what those social determinants of health issues or concerns are, and tie that to either the relevant topic of HIV or maternal health, to physical activity, to education. All of those areas in our life is controlled or dictated by something that is beyond our control, and that's who we are and the communities that we work out of. In research, I was following 750 gay and bisexual men in Seattle during the late 90s and early 2000, and got to see the phenomenon of Sarah sorting, got to see the phenomenon of undetectable levels and using that as a coded language of reducing the risk. And here we are today promoting U equals U, treatment as prevention. I remember before 2000, the term that was coined is undetectable levels. And since then, through clinical research, we have proven that undetectable levels of HIV in a person living with HIV, we have evidence to show that they do not transmit their HIV infection to their sexual partners. So U equals U means undetectable equals untransmittable. Even in Seattle, as liberal as we are, as close as we are getting to drive the number of infection down, there are always going to be someone left behind. And I could argue that most often it is Black, Indigenous, and people of color. So when I think about what is relevant today is what other populations have we either made assumptions about or have not fully understand the dynamics that make it difficult for them to prevent or treat their HIV infection. An example of that I could share is relating to trans people. It wasn't until 5 years ago that there was a national study that was conducted in the United States that allowed us to really see the impact of HIV in a population that is still to this day not recorded in census. And as a result, we illuminated that trans women in particular were at far greater risk than, let's say, even the population that we know to be vulnerable to HIV, and that's gay and bisexual men. So just by the sheer difference in proportion of population, trans people make less than 1% of the population, but yet if you look at the HIV rate, it's disproportionately higher. And it wasn't until that information through the National Lesbian Gay Task Force that was a call to arms in HIV prevention world to make better strides in engaging with transgender and non-binary individuals.